Noubar, Moderna is going to be a huge part of President Biden's ability to deliver on this big promise. What is the likelihood, given what you know, that he will be able to deliver 100 million doses in his first 100 days in office?
Well, Emily, thanks for having me here again. We believe that, at least on our side, the production, the quality checks, and the supply distribution capability exists for us to be able to play our part in meeting that objective. And so far, nothing we see discourages us from continuing to work hard to do that. But I think that the plans exist to do that, and the production systems are functioning according to our plans.
So the urgency has never been greater, given the soaring cases and the fact that the vaccine is out there. It is available. It's just a matter of getting it. Give us a picture of your production rate. Will Moderna be able to hit its own targets, 100 million doses this quarter, 100 million next quarter?
Well, look, we can do only as much as we're able to do, in the sense that we haven't done this and nobody else has done this before. So in other words, nobody has gone from zero output of this particular type of product to what we hope by the end of this year will be 1 billion doses we will have produced. So it's important for us to understand that because that has not been done doesn't mean it can't be done. But because it hasn't been done, we can't just say, oh yeah, we've done this 100 times before. We are in uncharted territory as a globe. We're in uncharted territory medically, and we're in uncharted territory in terms of production and supply. And so what we can do is to plan, have backups, have various measures put in place to be able to detect any faults very early on and compensate for them. All of those systems are in place. They're functioning. But until we have done that, we won't be able to point to having already done it as a reason to believe, because it's being done for the first time. We think that 100 million doses as a objective in the coming couple of months, and then another 100 million by the end of the second quarter as our commitment goal with the U.S. is something that we feel we're on track to meet. Lots of variables can get in the way.
Now, the vaccine shortages in New York and elsewhere are scary. You've got people out there who've gotten a first dose who don't know if they'll get a second dose, and certainly folks who haven't gotten any vaccine yet at all. I know that the New York issue specifically don't have anything to do with Moderna. It's actually your distributor that had an issue with the ice packs. That said, how many doses do you know may have gone unused in the United States because of temperature issues?
I don't have that information, and that's not information that I think is going to be ready to come by, because we're dealing with hundreds and thousands of outlets and a distribution infrastructure that is being run by McKesson and is being coordinated by the group that has been working, our counterparts under General Perna. So I think what's really more important is that we are all learning at a very rapid pace. The various states are learning themselves how they can get better organized, better forecast. There are issues with storage, as you said. Unfortunately, there's 2 different vaccines out that have quite different handling and storage requirements. And so we're all going to have to kind of be ready to recognize that there will be things that we're doing that don't work perfectly well. And look, the frustration we all feel is a different kind of frustration than the fear that we all felt that we were completely vulnerable to the virus and there's nothing we could do about it. Now there's something we can do about it, and we have to get organized and make sure enough time passes and enough experiences is accumulated so that we get better at doing this. We're going to look back at these days and say it was the first week, it was the third week, it was the fourth week, but at some point we are getting the trajectory, at least the learning experience is encouraging to us, and we're quite confident that if we all do what is within our power, we'll be able to get through this.
Now, there have been some allergic reactions to the Moderna vaccine in California. Any updates on a possible explanation for this, or any safety issues that you've identified with this particular batch?
The company put out a statement, Emily, which is the extent of what we can say and what we know, and that is that that batch, of course, contains quite a large number of doses, a lot of which have already been administered with no such reports. There appears to be a single site in which those reports come from, and we have not yet, and the CDC and the Department of Health and Government has not yet had the opportunity to really drill down on what could be the contributing factors to a particular location, a particular administration, to cause this observation versus a lot or the particular handling of it. So we're looking at all possible root causes, which is what we would do in any such report. And as soon as we can make a determination, we will. I think it's out of an abundance of caution that the regulators, the administrators within the state of California took an approach of basically stopping using that particular lot. And we're hoping that we will be able to, as quickly as possible, figure out what this is due to, and hopefully get all of those lots available for people to receive the vaccine.
What is your understanding at this point of whether we will need a third booster shot? And I know I'm jumping ahead a little bit, but I'm sure that you're planning to study this. Can you tell us what your plans are to examine that question?
There are many things that we will study, of which that's one of them as we go forward, because nobody really knows the degree to which the response that we're eliciting, which we know to be a very strong response, given the design that we chose with 100 microgram doses administered twice, roughly a month apart, that is we know generates a very robust immune response. Whether in the fullness of time we conclude that a further boost would be useful, required, and if so, when, will be something that we'll study, and we'll study in the context of the other phenomena that are going on with various new strains coming online. And so this is something that inevitably, the good news is the scientific questions are known. The bad news is we're going to have to gather data to answer them. We're not going to be able to assert them. It's easier, Emily, as you know, to point out what might not work than to know what does work. And the latter has a very straightforward approach, which is called the scientific method. So we will ask the questions, design good experiments with our partners, and get answers as quickly as we can. That'll guide the next step, and the one after that, and the one after that.
Now, your firm, Flagship Pioneering, is funding a number of other fascinating technologies and efforts to fight COVID, therapeutics, certainly beyond the vaccine itself. What are you most excited about, and what do you think might have the most sort of critical impact on our ability to get this under control and save lives?
Well, Emily, the COVID started out by being a pandemic that we kind of in our minds just thought about as an epidemic that was bigger than we thought. But actually, as a pandemic, it's had such reach. So many people have been infected that as we're learning about the consequences of the disease, both to those who are currently infected, but also those who had severe bouts with the disease, survived, but now are living with the remnants of that disease, this is going to be a major health challenge on the planet for years, if not decades to come. So we need to separate out what we're doing to halt the disease now from what we will have to do to cope with be either persistent versions of the disease coming back or the after effects. So we're working on all of that. We have companies, for example, that are using approaches to be able to use the microbes in our guts, which are very important in the way our immune system functions, to be able to control and regulate the overstimulation of the immune system that we see in a lot of serious COVID cases, where our immune system basically becomes the problem, not just the solution. We have a number of companies in our portfolio that have been looking at understanding the exact immune responses that can control the disease so that we can elicit those and only those versus a broad kind of broad-based attack that could cause the downstream consequences. We have some companies that are perfecting ways to draw samples and be able to do much better testing. And so it goes on. This is going to be a multi-pronged effort, and we think this is going to be worked on for many years. And technology and science will help in many other ways than just the vaccine.